Welcome back. Infections caused by a type of deadly flesh-eating bacteria are becoming more and more common and widespread with warm ocean waters. But does that have any impact on Arkansas lakes? With Labor Day weekend, joining us this morning is Baptist Health Infectious Diseases Dr. Amanda Novack. Thank you so much for being here.
Yeah, good morning.
So can you explain what this type of rare infection actually is?
Right, so when we say flesh-eating bacteria, doctors call that necrotizing fasciitis. And what it is an infection that gets under the skin and rapidly causes infection under the muscle of the skin.
So I know we've had an issue, we were just talking about, kids were affected here in Arkansas by this bacteria.
Right. So what we're seeing around the country is there's a bacteria called Vibrio vulnificus that's been a problem in the Gulf for a long time, but now as ocean waters get warmer, we're seeing those infections go up north. And so Connecticut, New York, upper Atlantic, we're starting to see those flesh-eating bacteria, and that's spreading. In Arkansas, we're not going to see a lot of Vibrio, that particular bacteria, but there's lots of other germs that live in the lakes. And so the big thing that we are concerned about is, intact skin is really good at protecting us from bacteria, but if we have wounds or cuts or non-healed areas, then bacteria can get in there and rapidly cause infection.
What are the symptoms that we need to look out for, or is it just too late once it actually happens?
Right, well, so no, I think, skin infections are really common, and a lot of times we'll go to our primary care doctor and treat those. Necrotizing fasciitis, when it's beneath the skin, is rapidly progressive, and one of the key features is it hurts so much more than it looks like it should. And so that can be a medical emergency and is a reason if the pain is spreading very quickly. The other thing I recommend, and this is just a silly trick that we use, but take a Sharpie marker and outline the redness or the irritation, and then we can see how fast that's spreading or if it's starting to recede.
So how is it diagnosed, and is there any treatment available?
Right, so antibiotics do help, but the mainstay for treating this flesh-eating bacteria is actually surgery. And so we want to clean out all that dead tissue as quickly as possible. And so it can be treated, but it has to be treated early and really aggressively. So anytime there's some concern about this, about a rapidly spreading infection in the skin or the muscles, then getting to the hospital right away. And we do imaging, we do CT scans, but really it's a doctor looking at it and saying, this looks like flesh-eating bacteria, we need to treat this right away.
So the people who should be, the people who are at most risk, those are?
Tends to be people that are immunocompromised. Occasionally a healthy, regular person will get this, but most of the time we see it in the elderly, people with kidney transplants or on chemotherapy, that sort of thing, with an abnormal immune system.
All right, doctor, thank you so much for being here. Dr. Novack is joining us. So you can contact Baptist Health by going to baptist-health.com or calling the Baptist Health line at 1-888-BAPTIST.